case, it would have been easier for me to come right here. But then I would have hit this vessel right here. And then I would have potentially contaminated my specimen with additional blood, which is not what we want to do. So here I am performing the FNA. I use a parallel technique. I go in, and this allows me to visualize the whole length of the needle at all times and lets me see the tip at all times. Using the perpendicular approach is appropriate in some cases, but in most courses, including AACE, American College of Surgeons and the College of American Pathology all teach the parallel approach. So again, there is, with your individual practice, you may do, but this is the current training that is being taught. The other thing I show about this is that how quickly this procedure is. This is not a procedure that is meant to be greater than 30 seconds. You're in, it's like a jackhammer, you're in, you're out. Because the goal isn't to show how beautiful the needle is. The goal is to actually procure a sample and put it on a slide so someone like myself or Dr. Minkowitz over here, who's a board-certified pathologist as well, would look at something like this and go, well, what do I have here? Well, I see groups of follicular cells that are flat, look bland looking. I see watery color in black, and I see a hemosiderin-laden macrophage here. There's a little close-up of that so you guys can take a better look. And this gives me a benign diagnosis, not this one image, but the whole slides. And so this was a benign colloid with benign colloid nodule with cystic change. Okay, so how good are we as clinicians in FNA technique? Well, until a couple of years ago, we didn't actually know. In 2008, the NCI, the National Cancer Institute, sponsored a symposium of prominent endocrinologists, cytopathologists, and radiologists to look at the state of science. How good are we at FNA technique? And these are some of the people on that, and maybe you recognize some of these people. But basically, there's three major points that was highlighted. Number one, ultrasound has dramatically improved our ability to sample accurately and decrease our non-diagnostic rate. The problem is there's no uniform guidelines on training on FNA technique, and they vary considerably. Now, these gentlemen are at sunny, where? Downstate. Now, the training there may be very different from the one I had at UCLA, or at Harvard, or at Mayo, or at Stanford. Last month, I went to Stanford to do some training, and their endocrinologists, you guys said, how many FNAs you guys have personally performed individually? Anywhere from 40 to 80? Okay, the number of the Stanford fellows that they have done individually is 4. Okay, so there's a huge discrepancy in the training of different fellowships. And that speaks of the need for some higher level of training within the endocrinology community. Okay, second thing. I don't know what that happened.
Don't blame me. I didn't do it.
You know that. That was in San Francisco. That was in San Francisco. Okay. And last but not least, in the literature, the current non-diagnostic rates vary dramatically. From less than 1%, which is what Dr. Minkowitz's rate is. He's actually one of the experts at FNA technique, and I'm very happy that he's here today.